So let us start with Nash therapeutic study streak for 5th of June, and the two remedies that we will discuss are injury remedies Ruta and Lidampal. What does Dr. Nash say about these two remedies and how we can use them clinically in our daily homeopathic practice? So the goal of reaching everyone out there through these video lectures, earlier Allen's keynotes and now Nash Therapeutics, is just that clinically and practically, what are the useful tips and hints that these homeopaths give to us, not theoretical, because when we read a remedy theoretically, it is totally different. And when we read something which is practically, clinically, with the help of a case or through experience of a homeopath, it is practically different. And this is the goal of Homeo Setu, which is a homeopathic startup with certain new innovations and concepts and ideas which I have created. We have created, and we are discussing Dr. Nash's leaders in homeopathic therapeutics. The remedies today are Lidum and Ruta. So let us start with these two remedies. So, as we know that both the remedies are pretty much injury remedies and they will be required in all cases of injuries, but there is a deeper action of Ruta like arnica on the periosteum, and it is like Rustox wants to change the position all the time. Wrists are more affected, which is what we see it's mentioned in all the different places. Aggravated by cold weather, aggravated by least change of weather, better by motion, and the specific action on the eyes is very much pronounced, like natramur, like sinega. They are very, they ache, they burn like balls of fire. Dr. Nash also tells us that Ruta is very good for prolapses of rectum. And if we read all the clinical books, we know that this is one of the remedies, along with some other remedies, good for prolapse of rectum or having action on rectum. For example, other remedies being Ignatia, muriatic acid, podophyllum. Now, Dr. Nash does not just give the remedies per se, but he gives an explanation of how they are different clinically with one or few sentences as needed in each remedy. And how is that? For prolapse of rectum, for example, for Ruta and Rustox, he gives the differentiation that Ruta is a more deeper on the periosteum rather than on the just the tissues and the joints. And similarly, he gives an example for Ruta for prolapses of rectum with muriatic acid and podophyllum. So, how do we clinically differentiate in the patient's scenario from the practical scenario? Muriatic acid will be very sensitive to touch, and for podophyllum, it is a characteristic diarrhea. We know offensive diarrhea of podophyllum involuntarily passed. Ruta will not have any of these symptoms. It is just their prolapse of rectum and the tissues are affected. If no other symptoms are there, so you rule out the other remedies and then you prescribe Ruta. That is the way for Ruta, which Dr. Nash mentions to us. Next remedy he picks up is Lidampal. Now, everywhere across the book, Leaders in Homeopathic Therapeutics, Dr. Nash has picked up related remedies, and this is how a homeopath should study. We cannot study a materia medica right from A, B, C, D because the remedies are scattered all across. Farrington, Nash, and some other authors have given the remedies in relation to each other. They have mentioned in a comparison, in a differentiation form, which is very important. And this is the way a homeopath should study rather than in a linear fashion alphabetically, which is not correct. And that is what we did in the Allen's keynote study streak. We picked up remedies which are related to each other. We picked up some similar and complementary remedies, and in Nash, it's all laid out by Dr. Nash himself, so we need not do any modifications. For Leadenpal, Dr. Nash writes it's a valuable remedy for rheumatism, especially inflammatory form, if it is there, and if it is being treated by old school homeopaths, old school allopathic doctors, it will always be left uncured and it will always progress to the heart, whatever be the treatment, whatever be their way of handling it. And the acute will progress to chronic, and the joints will be drawn out of shape and they will be driven to the heart. So, if a homeopath has a presenting complaint of a patient having heart symptom with no family history or with no link to the existence of the disease in his past, few many years, just ask the patient if he had joint pains, and chances are that he will tell you that there were some inflammations of the joints, and then after few years of no existence of such symptoms on the joints, the heart was affected. Valvular affections of the heart and all the heart muscle related affections, cardiomyopathies, or not circulatory related but muscular related heart troubles have their origin in joint complaints of a patient which have previously been occurred to them. The complaints for Lidampal, as described by Dr. Nash and as told by the patient, also will begin from the back, extremities, joints, and also it is very much opposite of Kalmia, which is, from the bottom for Lidampal it will start and then the top. So there is a particular way in which you approach such patients. Patients will come and tell you that my joints are paining. They'll point out to you in the elbow region. Then they will tell you that the lower limbs are also painful and the other parts are also painful. But if you trace the onset, duration, progress, and they will tell you that no, I do remember that elbows are just now affected since the last few months, but the complaints had started from the feet, which is exactly what Lidampal does for you. And if you know how to trace this picture from onset, duration, and progress, your job to pick up the remedy becomes easier, and all the other remedies are ruled out. So, Kalmia has above downwards more affections, whereas Lidum has below upwards. And for acute of Lidum pal, there is swelling, hot but not red, and swellings are pale, pains worse at night, and desires uncovering. And Dr. Nash tells us that it is almost similar to Merksol. So he gives you an idea or that if Lidampal has not worked and you feel that there is a need for another remedy, you will beat around the bush with another set of remedies, especially the joint remedies. They may not work. Merksol can be one of the remedies, but it has more perspiration. And in chronic complaints of Lidampal or patients presenting with Lidampal like symptoms for a long time, they will present to you with swollen, painful, and heat of the bed aggravating them. Hard nodes are there, the joints have turned into different shapes, and there is concretions. The joint shapes at certain parts have become more inflamed than normal, and the ankles are painful and soles are sensitive. So we see many times so many patients having calcaneal spurs or ball of the toe affected, uric acid affections. If it is a uric acid diathesis, then the set of remedies completely changed. But if it is just the joint affections, the small joints, then the bigger joints, below upwards, then you can think of Lidum and the other remedies. If the only the heels are sensitive, soles are sensitive, antim crude, lycos, silica, and ledum can be thought. And ledum pal like silicia, so you can say that silicia is also another cognate of joint affections, like Merksol. For ledum pal also, there is some symptoms which are similar, and silica also, which has lack of animal heat, and ledum pal also has this lack of animal heat. Now, what to do after you have given a patient arnica and patient is telling that still the pain is there, and you tell him that you keep continuing arnica for some few more weeks, and the patient reports to you that still I'm not feeling better. This is where Dr. Nash gives us the tip that after giving arnica, if the patient is not better in cases of bruises, ecchymosis, or deeper pains, Lidampal is the remedy which will finish the cure left by arnica. So, the best homeopath is one who knows when to bring which remedy into picture, when to stop which remedy, and when to start which remedy in acutes, in chronics. If you know this combination, and it's pretty easy, you just have to read the basic books, you just have to touch the basic literature, and it's there in front of you. Leadenpal comes into play after arnica. This is what Dr. Nash says. Ecchymosis on the body, there are remedies, arnica, sulfuric acid, as well as Leadenpal, which he says. But then he also says that ecchymosis in the eye. Now you'll be surprised to know the remedy name from Dr. Nash. It is Nux vomica. In the sclerotica or the conjunctiva, if there is ecchymosis, Nux vomica is mentioned by Dr. Nash, and he says that if the eye is entirely black, especially the tissues, not the conjunctiva, not the sclerotica, but the outer tissues, then Leadenpal 2C will do the work. If it is conjunctiva or sclerotica, then Nux vomica can be thought. Similar presentation he gives in symphytum also, but he tells that for all injury cases, see what is affected in the injury. Whether the nerves are affected, then think of hypericum. If the periosteum, the deeper tissues are affected, then think of ruta. If the bones are affected, think of calcarea fos and symphytum. Don't just blindly give arnica or ruta or calcarea fos or symphytum. Know what is affected, know the disease, and know the patient, and know their individuality, modalities, and prescribe the injury remedies. Otherwise, failure is inevitable. So, all the homeopaths who are passionately crazy about homeopathy and want to practice everyday homeopathy, and it's easy to practice, read the basic books and go through the basic literature. And with Homeosetu, we will be bringing some innovative ways so that you can access these books and tools very easily. Follow Homeosetu on WhatsApp channel, Instagram threads, and watch out for some interesting announcement coming soon in few weeks.